We're all familiar with the little injury or pain problems that crop up in life. We learn that if we ignore them, they gradually get better and eventually go away. But sometimes this doesn't happen. Sometimes when you try to push on through a painful problem, the pain keeps building up and getting worse. One example of this type of problem is called a tenosynovitis. This is just a fancy name for an inflammatory thickening of the protective lining around a tendon. Some common examples of tenosynovitis occur in the hand, such as trigger finger and DeQuervain's tenosynovitis in the wrist. On the inside, it looks a little like this: a tendon running along a bone and sliding backwards and forwards as your muscles pull on it. Some tendons pass under a stabilizing ligament, like this. To protect the moving tendon from the bone and ligament, there will be a synovial sheath. To understand why these problems tend to keep getting worse rather than better, let's look at the underlying process. An initial irritating episode happens, usually some kind of repetitive overuse. The body responds with inflammation, a normal response to irritation. The tendon lining then develops a reactive degenerative thickening. This jams up the tendon a little bit when it tries to move through the lining, which makes it easier to re-irritate the same problem the next time. You can see how this sets up a vicious cycle of increasing pain with less and less activity. Sometimes the thickening becomes severe enough to cause clicking, catching, or locking of the tendon. This is very common in trigger finger, but less common in DeQuervain's. It is common for us to see patients with very severe pain and disability from tenosynovitis, but their story is often one of slowly increasing pain that they thought was going to get better by itself, but never did. Why doesn't it get better? Let's use the analogy of a campfire to help picture what is going on here. The fire will only burn if it has fuel. Each irritation episode of painful activity is like throwing more fuel onto the campfire. As we add fuel, the fire flames up higher and hotter. This is like the inflammation increasing, and it typically results in more pain, tenderness, and sensitivity in the problem area. As the fire grows bigger and goes on burning for longer, the bed of coals beneath it become deeper and hotter. This is like the thickening, constriction, and degeneration that happens to the tendon lining and other soft tissues in the area. Even if the flames have died down, throwing kindling into a bed of hot coals will quickly result in the fire building back up again. Likewise, even if you settle down your tenosynovitis pain by avoiding painful activities for a few days, if the thickened tissue and restricted movement remains, it can easily flare up into painful inflammation again, and so the cycle goes on. So what do we do about it? This vicious cycle clearly needs to be broken. Each of the three elements of the cycle can be tackled with different treatment strategies. Number 1. Irritation. If each episode of pain, clicking, or locking is like more fuel added to the fire, the obvious thing to do is to try to avoid this. But when it is your wrist or hand that is affected, this is really hard to achieve. A splint or brace can be extremely helpful. We prefer to fit patients with customized thermoplastic splints, which are usually more effective and more comfortable than off-the-shelf options. For a triggering finger or thumb, it is often enough to restrict a single joint, whichever is the most clicky. In the case of DeQuervain's tenosynovitis, a very restrictive thumb and wrist splint is often needed. Number 2. Inflammation. In our campfire analogy, this is the burning flames and heat. The two best strategies to dampen a burning campfire are to starve it of fuel or to throw a bucket of water on it. Wearing a splint is hopefully starving the fire of fuel, but if this process is too slow or ineffective, the medical equivalent of a bucket of water is to inject a corticosteroid into the sheath around the tendon. A bucket of water does not always put out a fire, and similarly a cortisone injection is not guaranteed to eliminate the inflammation, but it is very likely to help to some degree. Number 3. Thickening. The bed of coals left behind from a campfire may take hours or even days to lose their heat. In the case of the thickened and degenerated soft tissues from tenosynovitis, the remodeling and restoration process may take weeks or even months, meaning that sometimes it can flare up again, many weeks after a corticosteroid injection or a course of splinting. Ongoing care is often needed to ensure that you do not get back into habits of performing the sort of aggravating, irritating tasks that act like kindling on the coals. The good news is that most people who develop trigger finger or DeQuervain's tenosynovitis make a complete recovery, with some combination of splint use and cortisone injection. The fire goes out completely and the person returns to full activity, just like before it started. Tenosynovitis, a common problem which, as you've seen, sometimes just keeps getting worse without the right treatment. If you think you may be developing a tenosynovitis problem, please get advice from a good health professional early and let them help you put out the fire. Thanks for watching. Share this video with anyone you think might be interested, and don't forget to subscribe to Flex Physio to make sure you don't miss our other videos.